You get a small cut on your leg. Maybe you scraped it on a fence, stepped on something rusty, or just got a random scratch you don't even remember happening. 24 hours later, you're in the ICU watching doctors literally carve chunks of your body away while you're still conscious, because if they don't, you'll be dead by morning. Welcome to necrotizing fasciitis, which medical professionals call flesh-eating bacteria, because apparently they ran out of nightmarish names that day. Here's what makes this absolutely terrifying. The bacteria doesn't just infect your skin. It burrows underneath, targeting the fascia, which is this thin layer of tissue that wraps around your muscles, nerves, and fat like biological shrink wrap. The bacteria release toxins that cause your tissue to literally die and rot while you're still alive, spreading along these fascial planes at a speed that makes wildfire look slow. We're talking about tissue death progressing at rates of 1 inch per hour in severe cases. That's your body decomposing in real time while your heart's still beating. The pain in the early stages is described as excruciating and completely out of proportion to what you can see on the surface. Imagine having what looks like a minor bruise or small red patch, but feeling like someone's pouring molten metal under your skin and peeling your muscles off your bones simultaneously. Patients report pain so intense that the strongest opioids barely touch it, and they're literally begging doctors to cut their limbs off just to make it stop, because apparently evolution decided that warning signals should be turned up to 11 when your flesh is being consumed by bacteria. But here's where it gets truly nightmarish. As the infection progresses and destroys nerve endings, the pain paradoxically decreases. Your body goes numb. That sounds like relief, right? Wrong. That numbness means the nerves are dead, which means the tissue is gone, which means you're running out of time. It's like your body's fire alarm shutting off because the entire building has already burned down. One guy in Michigan got necrotizing fasciitis from a small cut while fishing. Within 36 hours, doctors had removed his entire right leg, his left foot, and portions of both hands. He described the initial pain as feeling like his leg was being eaten by acid from the inside, while someone hammered railroad spikes into the bone. The surgery to remove the dead tissue is called debridement, which is medical speak for we're going to keep cutting until we find something that isn't rotting. And here's the really messed up part. Even with immediate treatment, the mortality rate is 20 to 30%. About 700 to 1100 people get this in the United States every year, and roughly 1 in 4 don't make it. That's basically Russian roulette with bacteria, except you didn't even know you were playing the game. Your pancreas has one job: produce digestive enzymes that break down food in your intestines. These enzymes are so powerful they can dissolve meat, fat, and basically anything organic. Now imagine those enzymes activating inside the pancreas itself, and you've got acute pancreatitis, where your organ literally starts digesting itself like it's a piece of steak. That's basically like if your stomach acid said screw the food and just started eating through your stomach lining, except it's actually happening in your pancreas. The pain hits suddenly, and it's described as the worst pain patients have ever experienced. And remember, these are people comparing it to childbirth, kidney stones, and broken bones. It's a constant severe pain in your upper abdomen that radiates straight through to your back, creating this band of agony that wraps around your torso. Patients describe it as feeling like something's exploding inside them, while simultaneously being stabbed from behind with a hot poker. One woman said it felt like her internal organs were being dissolved in battery acid while someone beat her spine with a baseball bat. Here's what's actually happening. Those digestive enzymes that should be breaking down your lunch are instead breaking down your pancreatic tissue. The organ swells, bleeds, and starts dying. Blood vessels get damaged, causing internal bleeding. In severe cases, you develop necrotizing pancreatitis, where parts of your pancreas actually die and turn into liquid mush that leaks into your abdominal cavity. Because apparently having your pancreas eat itself wasn't horrific enough, it also needs to leak its dead tissue into your body, like a burst pipe full of organic waste. The pancreas sits deep in your abdomen, surrounded by major blood vessels and organs. So when it starts failing, everything around it gets affected. The enzymes and toxic breakdown products leak into your bloodstream, triggering a systemic inflammatory response that's basically your entire body freaking out at once. Your blood pressure drops, your kidneys shut down, your lungs fill with fluid, and you go into septic shock. About 20% of acute pancreatitis cases become severe, and of those, the mortality rate is 15 to 30%, even with intensive care. Treatment is equally brutal. They can't give you food or water because that stimulates the pancreas to produce more enzymes, which means more self-digestion. So you're lying there in the worst pain of your life, unable to eat or drink, with tubes draining fluid from your abdomen while doctors pump you full of fluids and antibiotics intravenously. Some patients need emergency surgery to remove dead pancreatic tissue, which is like trying to clean out an infected wound, except the wound is a vital organ deep inside your body. One alcoholic patient described his acute pancreatitis as feeling like his insides were being microwaved while someone twisted a knife in his gut. The pain was so severe he said he would have preferred death, and he wasn't being dramatic. Imagine waking up one day and your muscles are turning into bone. Not metaphorically, literally. Your soft tissue is transforming into a second skeleton that slowly encases your body in a biological prison you can't escape from. That's fibrodysplasia ossificans progressiva, or FOP, and it's one of the rarest and most horrifying genetic diseases on the planet. Only about 800 people worldwide have it, which sounds like good odds until you realize there's no cure, and it's inevitably fatal. Here's how this nightmare works. You've got a genetic mutation that causes your body to misinterpret soft tissue damage as a signal to grow bone. Any minor trauma, even a bump or a viral infection, can trigger a flare-up where muscles, tendons, and ligaments start turning into solid bone. The affected area swells up, becomes hot and red, and the pain is described as intense throbbing agony that feels like your muscles are being cooked from the inside. One patient said it felt like his shoulder was being crushed in a vice while someone poured molten lead into the joint. But here's where it gets truly nightmarish. As the swelling goes down over weeks or months, the soft tissue doesn't return to normal. It turns into bone. Permanent, immovable bone that fuses your joints and locks them in place forever. A flare-up in your neck means you might lose the ability to turn your head. A flare-up in your jaw means eating becomes impossible. One teenager had a flare-up in his back after falling off his bike, and within 6 months his spine had fused into a rigid column that left him hunched over permanently. The disease typically starts in childhood, beginning with malformed big toes at birth, then progressing upward through the body as flare-ups occur. By their 20s, most FOP patients are essentially locked into whatever position their body froze in, unable to move their arms, legs, or torso. The extra bone growth restricts lung expansion, making breathing difficult and eventually leading to respiratory failure. It can also make eating nearly impossible when the jaw fuses shut, leading to severe malnutrition. And here's the truly twisted part. Surgery makes it worse. Trying to remove the extra bone triggers massive flare-ups that create even more bone growth. It's like trying to put out a fire with gasoline. Even biopsies are dangerous. One patient had a small surgical procedure to remove extra bone from his shoulder, and the resulting flare-up created 3 times more bone than was removed, completely fusing his entire shoulder and arm to his ribcage. The pain comes in waves with each flare-up, and there's no way to predict when they'll happen. Could be tomorrow, could be next month. Living with FOP is like waiting for your body to randomly decide which part of you it's going to transform into a movable bone next, all while experiencing pain that feels like your skeleton is growing through your muscles. Your intestines are supposed to absorb nutrients from food and turn everything else into waste. With inflammatory bowel disease, your immune system looks at your intestinal lining and decides that needs to die and launches an all-out assault on your own digestive tract. We're talking about Crohn's disease and ulcerative colitis, where your body literally attacks itself and creates open sores, bleeding ulcers, and holes in your intestines while you're just trying to eat a sandwich. The pain is constant. Severe cramping that patients describe as feeling like someone's twisting their intestines into knots, while simultaneously stabbing them with broken glass. Unlike regular stomach pain that comes and goes, IBD pain is relentless. You're experiencing what feels like the worst food poisoning of your life, except it never stops and there's blood. Lots of blood. Some patients have 20 to 30 bloody bowel movements per day during flare-ups. That's basically like having dysentery except it's your own. Immune system causing it, not contaminated water. Here's what makes this particularly nightmarish. The chronic inflammation doesn't just cause pain, it literally eats holes in your intestines. These holes can tunnel through to other organs, creating fistulas, which are abnormal connections between parts of your body that should never be connected. You can develop fistulas between your intestines and your bladder, meaning fecal matter leaks into your urinary system. Or between your intestines and your skin, meaning you've got literal holes in your abdomen leaking intestinal contents. Because apparently having your immune system destroy your gut wasn't enough suffering, you also need bodily waste leaking into places it shouldn't be. One Crohn's patient described the pain as feeling like shards of glass moving through his intestines combined with someone repeatedly punching him in the intestine, when that stomach, while his insides were on fire. The inflammation causes strictures, which are narrowed sections of intestine that can cause complete blockages. When that happens, you've got a surgical emergency where your intestines could perforate, spilling bacteria and waste into your abdominal cavity and causing potentially fatal peritonitis. Treatment involves powerful immune-suppressing drugs that leave you vulnerable to infections or surgical removal of damaged sections of intestine. About 70% of Crohn's patients eventually need surgery, and many need multiple surgeries throughout their lives. Each surgery means losing more intestine, and you can only lose so much before you can't absorb enough nutrients to survive. Some patients end up with colostomy bags, where their intestines are rerouted to drain into an external bag because their colon is too damaged to function. And here's the really twisted part. Even during remission, when the inflammation calms down, many patients still experience chronic pain because the disease has permanently altered their nervous system. The pain pathways get rewired, creating a condition where your gut hurts, even when there's no active inflammation. It's like phantom limb pain, except your intestines are still there, they're just broken forever. Imagine your body randomly deciding that parts of you need to swell up to 3 times their normal size, and you have zero control over when, where, or how severe it'll be. That's hereditary angioedema, or HAE, a genetic disorder where your body loses its ability to regulate inflammation, causing unpredictable attacks of severe swelling that can kill you if they happen in the wrong place. About 1 in 50,000 people have this, and until recently, there was basically nothing you could do except hope the swelling didn't close your airway. The visible swelling in your face, hands, and feet is bad enough. Imagine your hand ballooning up like a rubber glove filled with water, the skin stretching so tight it might split. But the internal swelling is where the real horror happens. When an attack hits your intestines, fluid builds up in the intestinal walls, causing severe cramping pain that patients describe as feeling like someone's inflating balloons inside their abdomen while simultaneously twisting their guts with pliers. The pain is so severe it mimics surgical emergencies like appendicitis or bowel obstruction, leading to unnecessary emergency surgeries before doctors figure out what's actually happening. Here's what makes this absolutely terrifying. Attacks are completely unpredictable and can be triggered by stress, minor injuries, dental work, or literally nothing at all. You could be fine 1 minute and in excruciating pain the next, watching your stomach distend as fluid accumulates in your intestinal walls. One patient described an abdominal attack as feeling like her organs were being crushed from the inside while someone poured acid into her digestive tract. The swelling can last anywhere from 2 to 5 days, during which you're basically incapacitated by pain. But the nightmare scenario is when the swelling hits your throat and airway. Your tongue swells up, your throat closes, and you've got maybe minutes to get treatment before you suffocate to death. Before modern treatments, about 30% of HAE patients died from airway swelling. That's basically like having a loaded gun pointed at your throat that randomly goes off and you never know when it's coming. Some patients describe feeling a tingling in their throat and knowing they've got maybe 30 minutes to get to a hospital before they can't breathe. Treatment involves carrying emergency medications everywhere because an attack can strike anywhere, anytime. One woman had a throat attack while driving and had to pull over and inject herself with medication while her airway was closing, all while trying not to panic because stress makes the swelling worse. Because apparently having your throat randomly close up wasn't stressful enough without adding that extra layer of irony. Living with HAE means living in constant fear of the next attack, never knowing if today is the day your body decides to swell up and potentially kill you. It's like having a time bomb inside you that's set to a completely random timer. So what connects these 5 nightmares? They're all conditions where your body becomes the weapon that destroys you. Whether it's bacteria eating your flesh, your pancreas digesting itself, your muscles turning to bone, your immune system attacking your gut, or your tissues randomly swelling until you can't breathe, the horror is the same. You can't escape because the threat is literally inside you. We figured out how to transplant hearts, cure certain cancers, and edit genes, but we still haven't solved the fundamental problem of bodies that decide to self-destruct in the most painful ways possible. Sleep tight,